The Ford government spent just more than $100 million of our public funding on advertising in the last year. That's the highest amount ever, and 15 of their ads were paused after the Auditor General deemed them to be partisan. Let's look at the actual record of what the Ford government's done in healthcare, not what they say. A million more Ontarians don't have family doctors. In 2016, before the Ford government was elected, 1.3 million people didn't have a family doctor. By July 2024, there were 2.5 million Ontarians without a family doctor. A record number of emergency departments have closed, even worse than the 868 closures in 2023. Before 2018, when the Ford government took power, emergency department closures were almost unheard of. 2,000 patients on average each day are waiting on stretchers in hospital hallways. This is the highest number ever, and more than double the number in 2018 when the Ford government was elected. They're expanding private clinics instead of stopping them from charging patients record-breaking illegal fees. We have heard from an 80-year-old woman in Ottawa who is being pressured to pay a private clinic $11,000 for cataract surgery, and we hear from many more who've been charged thousands. They're paying a for-profit hospital more than double the cost per surgery than our public hospitals, and they increased funding to that for-profit hospital by 278%. Ford's former health minister, Christine Elliott, left office and became a lobbyist for the corporation that owns this for-profit hospital. Ontario funds our public hospitals and public healthcare at the lowest rate per person in Canada. For most of the previous financial year, the Ford government held public hospital funding well below the rate of inflation, while increasing funding for private clinics by more than 200%. The underfunding of our public healthcare and the shifting of our public funding to for-profit clinics and hospitals isn't a coincidence. It's the plan to dismantle and privatize public healthcare in Ontario. So please, vote to protect and improve our public healthcare in the coming days, or we're going to lose it.